My name is Dr. Kim Eagle. I'm one of the directors of the Franco Cardiovascular Center at the University of Michigan. I'm one of the co-founders of Project Healthy Schools. This is an initiative that we began more than 15 years ago to try to serve the nutritional and physical health needs of students in Michigan. Over the past 15 years plus, Project Healthy Schools now provides wellness programming and celebration of health in over 100 middle schools in our state. We've reached over 70,000 students with important messages around nutritional and physical health. And in our studies to examine the impact of the program, we've seen significant benefit. We've seen cholesterols fall, we've seen improvement in blood sugar and exercise tolerance, all suggesting that as a result of this curriculum, we're improving the health of Michigan's students. This is our future. Thank you for joining us.
Good morning, everyone. My name is Ryann, and I'm a proud member of Project Healthy Schools. And I'd like to welcome you all to our Project Healthy Schools community conversation today. Whether you've been with us from our inception in 2004 or tuning in for the very first time today to see what we're about, either way, we're thrilled that you're here, and we look forward to sharing what we've been up to and how we've been able to pivot during this time of uncertainty and continue to make an impact in the lives of our youth, along with what our vision and our priorities are moving forward. We have an incredible group of panelists with us today, but first, let me just say thanks to all of you who submitted a question in our RSVP form. We will be working to answer as many of those throughout the presentation today and later on during our Q&A. We will also be accepting live questions during the Q&A portion of today's live conversation. For those of you who are joining us through Zoom today, please feel free to use the Q&A feature to ask your questions, and we will do our very best to get to as many of those as possible. You'll also note that we have a live transcription on for today's webinar, and you may turn it off if you'd like, and you just simply need to click the CC box in the bottom right-hand corner and then click Hide Subtitles. So without further ado, let's introduce our panel. First up, we have Jean DuRussel-Weston, who is our manager of Project Healthy Schools. Also with us today, we have Ben Rancier, who's our curriculum and training coordinator for Project Healthy Schools. And last, but certainly not least, we have Dr. Kim Eagle. And Dr. Eagle is the Albion Walter Hewlett Professor of Internal Medicine, director of the Franco Cardiovascular Center at Michigan Medicine, and is one of the co-founders of Project Healthy Schools. And now at this time, I'd like to invite Dr. Eagle to join us and share the historical context of Project Healthy Schools, how we got here and where we're going. Dr. Eagle.
Thank you, Ryan. And thank you to all of you for joining us today. Project Healthy Schools is truly a labor of love. An effort to help the health of Michigan's youth. They're our future. Their health determines the success of so many things in our lives, in our state, and our nation. Nearly 20 years ago, we recognized that in the middle schools there were really no consistent programs that promoted health. And of course, all of you are aware that with kind of the fast food nation and the video games revolution, over a period of 30 or 40 years, we saw generally a steady decrement in both the nutritional health and the physical health of our nation's youth. And certainly Michigan is no exception to that. And I was just absolutely thrilled when Michigan Medicine and the university were willing to support a pilot that we did in a middle school in Ann Arbor to see if we could create lesson plans that students would enjoy in the middle schools that would promote nutritional and physical fitness health among our youth. And of course, it was important that we measure whether or not the things that we were trying were successful, both in the knowledge that the children had and also in terms of their behaviors and their physiology. So we've worked hard with the university's preventive health experts to try to create a program that really brings nice, interactive, enjoyable programming to middle schoolers. And we use the school as our unit of intervention. We work with the cafeterias, the leaders, the teachers, to try to imagine the celebration of health and the offering of both movement and nutritional health that will allow our students to be healthier going forward. So for me, it's hard to imagine where we started 18 years ago, but here we are today. And I'm really excited that Jean and Ben can share with you our progress, and we'll talk a little bit more about our vision for the future. So thanks for joining us, and let me turn it back now to you, Ryan.
Thank you, Dr. Eagle. And at this time, I'd like to turn the mic over to Jean and Ben, who are going to share with us a program overview of PHS, who we are, what our makeup is like, and even what makes us different. So Jean, Ben.
Thank you, Ryan. I think we're going to just start quickly with elaborating a bit on what Dr. Eagle said about our history. So you can see from this slide, we started in 2004 and built on many partnerships to get to where we are now with over 140 schools. I think one of the most memorable pieces about this is our partnership with Building Healthy Communities in 2013, which has helped us to be able to expand across the state. Next slide. And this is all the locations right now that Project Healthy Schools are in. So I'm not going to go over every single one, but I just want to show the audience that we are across our whole state. And our goal is, of course, to be in every middle school in the state of Michigan. And we're well on the way, but there's a lot of work to be done. Next slide. So since 2004, we've reached over 141 schools in 47 counties, and we're currently in 106 schools. And so we have a retention rate of 75%. That is our goal, to go into the school, change and improve the environment, and stay there forever, because we want behavior change that will last a lifetime for students. We have over 88,500 sixth grade students that have received our curriculum. And really the beauty of the program, I think, is that it does last year after year in the same school. And then, of course, we have some research that we have 25,700 students that have been there. Next slide. So we have 5 goals at Project Healthy Schools. Eat more fruits and vegetables, choose less sugary foods and beverages, eat less fast and fatty foods, be physically active every day, and then, of course, spend less entertainment time in front of a screen. All based on what we found way back in 2004 that was causing obesity in youth. Next slide. So this is briefly just an overview of our research, just to show you, as Dr. Eagle mentioned, we know that this program works. And we are very excited about the fact that as you can see on the right-hand side of this picture, 56% of the students said that they eat more fruits and vegetables. 49% said that they get more physical activity. I mean, these are the things that we're trying to, change for the future for students. And actually, all of us could probably benefit from this as well. So, and the graph on the left just shows you that this is a sustainable program. We measured students from 6th grade through 9th grade, and we saw a steady decline in the total cholesterol and the LDL cholesterol, triglycerides. So we know the program works. Next slide. And this slide illustrates to us that we have interventions in both communities that are high resourced and less resources. And what we found in the less resourced communities is that students start out with possibly, higher cholesterol rates, less exercise, but then they respond quicker to the interventions. And so that we can really improve, just give a little bit of intervention to places that don't have a lot of resources, and they can improve their behaviors and increase a lot of positive things with our interventions. And I think now I'm going to turn it over to Ben, who's going to continue the overview.
Actually, before that, Jean, we had a question
Okay.
that came in. And the question is, does PHS offer any wellness resources for staff in our schools? So if you want to field that, or maybe Ben would want to talk about
yes,
that.
why don't we give that to Ben, and he can
Okay.
then.
Sounds good.
Yes, thank you. Hello, everybody. Again, my name is Ben Ranciere. I'm the Curriculum and Training Coordinator for Project Healthy Schools. Been a part of this fabulous program for over 5 years now, and it's really been a fascinating experience seeing this program modify and adapt to the ever-changing needs of our students and our schools, and as Ryan just alluded to, our teachers as well. And so I'm excited to share a little bit with you just about how the program works. I think our results are well documented over the past 16, 17 years, but I know you're all dying to hear, how do we do it? What does this look like within the schools? And so if you would advance to the next slide for me. Just a little bit more about our impact. See our publications to date, a lot of conference presentations throughout the years as we've been able to share out the work that we've been able to accomplish in schools here in Michigan, Arizona, and we've modified the curriculum to Bangladesh, and we'll talk a little bit more about that moving forward. And as a result of our results in our fabulous team, I think that's one thing that potentially sets us apart from others, is just a wonderful team. And we have a lot of folks on our team that come from different backgrounds that we've been able to really put together and make a big impact in schools and most importantly for students. And we've received some recent recognition for those efforts. The University of Michigan's President's Staff Award of Distinction, and then most recently the Governor's Fitness Award for Extraordinary Organizations. So what does the program look like? And I'm going to kind of address our staff wellness question here as well. But a few years ago, we adopted a 5-step process to school wellness. And it's really, we found to be a really great model that provides a little guidance and a little bit more structure for our school-based folks to follow. It's also proved to be very valuable as we continue to sustain the program in many schools over the past 14, 15, 16 years. And so it really starts with building support, building a foundation for health and wellness. We know that there are lots of opportunities within schools, and it can become a little bit overwhelming for our school-based staff. What should we work on? What should we prioritize? How do we prioritize it? Where do we start? And so we start with building support. And what we do is we identify what we call a wellness champion. That is a school-based staff member that really helps us implement the program on within each of the school campuses that we work with. This could be a teacher, it could be a science teacher, it could be a health or a PE teacher, it could be a social worker, it could be a nurse. It's really, we're really working with school administration to identify somebody who's really passionate about health and wellness, who's got the leadership skills and capabilities that can really help spread the word, not only within the school, but across the school community. And so we work with this wellness champion to then build a wellness team. And over the years, we've seen more students become involved in these wellness teams, and it's really been great. It's students kind of have a unique perspective on things within the school environment, and can really kind of help guide and run ideas through. Is this going to work? Our kids, is this going to resonate with the students at your school? And so we've really relied a lot more on school leaders working with students to get them involved and engaged within these wellness efforts across the school. From there, we move into our assessments. That's where we really learn how to prioritize the school needs. And so we use the Healthy School Action Tool to work with our schools to assess the current school environment. What does it look like? Where are the high priority areas that we should start to focus on? From there, we build an action plan. We work with the wellness team and the wellness champion and the school community to create, goals based on what we've learned from our assessment tools. And we create an action plan, and we create goals for nutrition and for physical activity and for staff wellness is something that we've recently added. We've really found that, we can teach students about this stuff, but if we can't change the environment, it makes it really challenging for students to practice the skills that we've taught as far as health and nutrition. We've recently added a staff wellness goal, and we've added an assessment tool for that to get a better peek at staff wellness behaviors as well. Again, so we can prioritize where to start, what our staff members are going to be interested in, so that we can help create that goal. And then we have an overarching, just where's another high priority need that maybe we haven't been able to address. So we create four actionable goals through our action plan, and then we use those goals to really create unique programming that will meet the individual needs of that school. It's always fascinating when you think about a school that they're all charged with essentially the same mission, which of course is teaching and learning. But it is really amazing to see how they all get there in different ways. And so I think it's important for us to be able to, create programming that is unique to those individual needs. And so there we teach our health education curriculum to the students in the school, and we work with our action plan to create what we call wellness initiatives. And so we really think of the program as an educational component with the environmental component, and changing the school environment through policy changes, through system changes, thinking about how they do things. There's something, simple as, we know that the kids who engage in physical activity or recess before lunch are going to be more apt to go into that cafeteria and eat healthier foods. And so maybe just working with the school to change how they do things. Maybe the things are in place, but we just want them just to kind of rethink and what's going to be a more sound approach to health behavior change within the schools. From there, we kind of circle back, as we've alluded to. We want to make sure that what we're doing is working. Is it meeting the needs? And so we do a lot of measuring of our work within the schools. We gauge, the teacher from a teacher perspective, from a student perspective. Are the kids learning what we expect them to learn, what we want them to learn? But also, are they talking about it? Are they excited about this? Are they sharing this information with others? And we found that, students do talk about it. And that's one of the really goals of the program, is to get kids talking about it. It become part of their everyday life, not just a lesson where they go into a classroom, learn about it and walk out, but we want them to walk out with, feeling good about it and talking about it and sharing it with their friends and their family. And then this is a really nice sustainable approach. And so we use what we call a gradual release model. And I think another thing that kind of sets us apart is Project Healthy Schools, we place wellness coordinators in the school. And so to start, we're leading the wellness champion and the wellness teams through this 5-step process, and then gradually kind of turn it over to them. So by year 2, they're really starting to take ownership of the program. They're now leading with us kind of supporting. And so that is what the program looks like within the schools. Nate, if you will go to the next slide. And then another thing I think that really sets us apart is our partnerships. And Jean had alluded to our partnership that started with the Building Healthy Communities Coalition back in 2013. And you can see a lot of the members there of this coalition: Blue Cross Blue Shield of Michigan, Michigan Department of Health and Human Services here, us at Project Healthy Schools, Michigan Fitness Foundation, United Dairy and Michigan, or means more, Wayne State University, who we partner with, and I expanded that partnership recently to try a district-wide model approach, which we were in year 1 with Farmington Public Schools, and taking a look at what does this look like, when we can go in and we can work with district administration. And so that's been a really fascinating and neat experience to be involved in that with our partners at Wayne State, Michigan Apple Committee, PEAK. So that's a program to educate all cyclists. And so you can see down there at the bottom, University of Michigan as well. And so we've got a lot of fabulous university partners. We have a lot of community partners as well that I've alluded to. And so I just want to highlight just a couple of partnerships here within the university. And so we've found, and it's, I guess it's nothing really new, but we know that chronic kidney disease, Wayne County here, right next to us here in Washtenaw County is a hotbed for chronic kidney disease. So we've been able to partner with some fabulous physicians over in the Department of Nephrology to create a 3-lesson unit on kidney health and create this interactive kidney model where students can actually practice filtering stimulated blood and urine through a kidney that works well, and then one that has doesn't work so well as a result of behavior choices throughout the years. And so lots of partnerships. I'm hopeful to share a little bit more about that as we move forward. But also at the same time, I think it's important to note that we're also always looking for new partners. And so if you're on the call, if you're out there, and I think there's opportunity for us to partner to create meaningful programs in the schools, then please reach out to us. So I know I have gone over a little bit, so I'm going to turn it back over to you, Ryan.
You're good, Ben. That's great. It's the passion. That's what drives our work, right? So thank you and Jean for sharing. As we transition, I see that we had a poll question up. So want to make sure everybody was listening as far as how many students Project Healthy Schools has helped since the program was founded. Majority of you were spot on, 88,500 students that have been impacted. So thank you for responding to that poll. What's next? So I'm going to invite both all of our panelists, Dr. Eagle, Jean, and Ben, to share with us a little bit more about our impact, but also what are our specific priorities for Project Healthy Schools, and what does our vision look like moving forward? So Dr. Eagle, I'll start with you.
Yeah, thank you, Ryan. Ben, it's too bad you don't have any enthusiasm. I think everybody can see that this is an infectious personality who's incredibly informed. I like the mention you made of the partnerships is critical. As we move into communities, we want to be absolutely embracing the team notion of community-based effort. We don't want to come into a place where we're not needed. We want to add value to the school environment. We don't need to compete with others in this space. We just want to add value. It's an important notion too that we view this as a community university partnership. This is not about the university, this is about the students. And everything we do is about the students. And Jean mentioned some of our research. The research is not the university going into communities and studying kids. The research is to actually study what we're doing to make sure that it works and evaluate how we can make it better. So all of this is a notion that our entire focus is on the children. And everywhere we go, we find individuals, we find families, we find foundations, we find other organizations that are engaged in health of youth. And we want to bind with them as tightly as we can to improve the overall impact on our students' health. And Ben mentioned every school is different. Some of them want to start a garden club where they have their own garden. Some of them want to promote a sport like squash in Detroit, things like that. So this is truly a labor of love in a partnership between a great public university and kids all over our state. Now, this past year has been obviously a tumultuous one for all of us in our nation. And one of the things that I've challenged our entire team to think about is, are the programs we're offering emphasizing the importance of diversity, equity, and inclusion? Are our messages socially balanced? And similarly, when we're talking about health, are there messages that we can provide regarding the pandemic we're in that will also be important for our students in thinking about their future health? And so maybe I'll ask Jean and Ben to comment on where we're at with thinking about those areas of opportunity.
Thank you, Dr. Eagle. I'll talk a little bit about the COVID-19 lessons that we created for students to, where they're available to add to the curriculum. And it's for students to be aware of infectious disease. And as you said, how is this going to play a role in their future? And actually, I think also to make them feel more at ease about what's happening in their world today with COVID-19 and infectious disease as a whole. So we went ahead and those are available for schools. Ben, do you want to talk a little about DEI?
Sure thing. Yeah, so just to reiterate what Jean was mentioning again, I have one of the coolest jobs ever. We're able to identify the needs of the schools and rely on our university-wide partners and community partners to create educational opportunities and programs. And COVID-19 has certainly brought about a lot of challenges to schools and school-based programming. But I think it's really important to highlight the opportunities that it's also brought to us. And, we've been able, again, to partner with the medical school to create these COVID-19 lessons, to teach students a little bit more about that and kind of their role in mitigating the spread of COVID-19 and other infectious diseases. We're also expanding a partnership with Trails out of the Department of Psychiatry here at the university to focus a little bit more on the social emotional learning of students and creating, again, educational opportunities for students to learn coping strategies and stress management and things like that, things that have really risen. When we think of barriers to learning, as a school-based program, it's really come to, the top, the surface of when you think about things that are going to prohibit, a student from learning and the social, their emotional wellness can certainly be a barrier. So we're really excited about that. When we think about staff wellness as well, we've been able to, again, partner with Trails, translating research into action to improve the lives of students here from the university. And we created some self-care modules for staff wellness. And so guiding staff members through a series of self-care sessions around mindfulness and just on helping them understand the importance of self-care and how physical activity relates to that. And then also working with them to find ways to cultivate joy in those little bit more stressful times. And so we're really moving, from exercise, not away from exercise and nutrition, but just creating more programming, more learning opportunities, not only for the students, but for staff members as well, as we start to look a little bit more and dive more into those citizenship, civic responsibilities moving forward. As Dr. Eagle alluded to, also thinking about, diversity, equity, and inclusion, and where we're at with that. And so, again, a wonderful team here at Project Healthy Schools, and we've kind of come up with lots and lots of ideas and brought about lots of opportunities of how we can tweak our programming so that it is more diverse and more equitable and more inclusive. And so some of the things that we're working on right now is number one, training our staff, training teaching staffs on these principles of diversity, equity, and inclusion. Each year, another thing I think that sets our program apart from others is the professional development opportunities that we offer to teaching staffs. And so each fall, we have our Wellness Champion Gathering, and this year, we had to again pivot and do a virtual presentation, which was a highly successful event, especially for our first run through. But we were able to partner with the Center for Educational Outreach and DEI expert to work with our teaching staffs on inclusive teaching principles. And so, we want to really just make sure that our staff is ready and to go into schools and kind of have these conversations with school-based folks on DE&I and making sure that the wellness initiatives that we offer align with that, making sure that our materials, our teaching materials are representative of the diverse communities that we serve, again, across Michigan, throughout Arizona, and Bangladesh as well. And so thinking in those terms, so making sure that we're trained, that we're confident and comfortable and going into schools, no matter where the community is, that we can support those efforts within the school. And then focusing on teaching. And so our lesson delivery, again, another opportunity for us during COVID has been to rethink how we deliver our lessons, and our traditional, in-class lessons, which are very hands-on, discussion-based, behavior replacement type activities and learning opportunities. And so our traditional model, isn't going to work across the schools that we serve, with a lot of schools serving students remotely. And so we created digitized versions of our lessons, using the principles of teaching engagement, where it's not just students watching a long video. We know that, in today's day and age, that doesn't resonate very well with students. And so we've created short instructional snippets, and then infuse those into, the lesson plan. And so students watching a short lesson video on a nutritional concept, maybe a macronutrient or micronutrient, or the importance of physical activity, and then the teacher-led discussion with the students, and then an activity, and then switching to another short instructional video. And so we found this to be a wonderful opportunity to engage, again, campus and community partners to help us deliver these messages. So again, that the messaging, the educational content is diverse and inclusive. And so we're really excited about that as we move forward. And then just making sure that we're focusing on inclusive implementation. So, looking at that, funding streams into the schools, and taking a little bit deeper dive into some of the social determinants of health that we can kind of tie into, and again, make sure that we're meeting the needs of these diverse communities throughout Michigan. So I'm going to stop there, take a pause, and just, again, encourage each of you out there to take advantage of that Q&A or that chat box. We want this to be conversation style. I know that we're going to have a Q&A at the end for you to ask questions, but I want to make sure and reiterate to you that if you have a question while you're thinking about it, pop it in that Q&A, pop it in the chat. Let's talk about it while you're thinking about it. So.
Yeah, good segue, Ben. So we actually do have a few questions. One is screen time now has a new meaning because of virtual learning. How have you adapted your measurement and messaging about screen time this past year?
Yeah, that's a really interesting question. It is something that we're focused on, and we've actually kind of tweaked our messaging a little bit. For those of you who have been friends of the program for many years, you may have noticed when we passed along our goals at the beginning, one of our 5 goals is to spend less time in front of a screen. We know that a lot of students are now learning on the screen, and we certainly don't want to inhibit that. And so we're now focusing on spending less time in front of an entertainment screen. So when students are not engaged in active learning, when they have some free time, focusing on ways to be more physically active during that free time instead of sitting in front of a screen. And it's a struggle, and it's a challenge, and it's something that I experience in my own home with my young kids, is just working to find ways, creative new ways to get up, be active, get moving, get away from the screen, because they're spending so much time on it. And so, again, just infusing the importance of physical activity into the schools, working with the schools to provide programming. Another really cool university initiative that we have worked on over the last several years with some university partners is incorporating physical activity breaks into the instructional day. And so we've, it's pretty well documented now, the importance of physical activity as it relates to cognition. And we know that students who engage in physical activity throughout the instructional day are more alert, they're more engaged, and most importantly, they're more on task. And so we've worked with School of Architecture and School of Kinesiology and School of Education to create a fabulous program for schools to get kids up, get kids moving throughout the course of the day to help them feel better, to, again, get more physical activity in, get away from the screen, things like that.
We have another question that is, I've been at home with my child for a year now. She's been in virtual schooling. Are there any PHS wellness resources for families?
I will take that, Ryan. Yes, we do have a lot of resources for families. We, at the beginning of the pandemic, put together a website that was just, focusing on how can you do things at home together. The other thing that we do with our lessons is we encourage students to, share this with their families. So there might be an activity where it's about healthy vegetables, and there might be a game along with it where the family can do this together and search for the healthy vegetable in their kitchen, or go to the grocery store and look for the different kinds of milk. What's the best, in terms of % of fat? Those kind of things are available for families. A lot of physical activity resources on the website, and that is open to everybody. So I would encourage families to go to our website, projecthealthyschools.org, and click on the resources and see what's out there.
Something as simple as simply getting up for 5 minutes every hour and walking around the house, or engaging in stretching or yoga or something. We can approximate 30 to 45 minutes of physical activity recess in the home by just being disciplined in how we use each hour. And when we've studied this in the classroom with the School of Kinesiology, we've found that when students get up, they can come right back and focus on the academics after that period of time. We thought maybe they would kind of be wandering, but it was the reverse. They can focus. And so this is a really simple way of getting your child up and about on a regular basis.
Wonderful. What about when it comes to the program's future long-term goals and vision? Would you three care to elaborate on that a little bit?
Well, let me start. What I would say is that our goal is to try to reach as many students as we can. It is ironic that a few years ago, we were given a grant from a foundation up in the Upper Peninsula to develop our distance learning modules to reach students in the UP, because it was difficult to send our staff up there on a regular basis. And that experience prepared us for what would eventually happen with COVID. So we pivoted very quickly with the COVID experience to provide digital learning to our students. And this really creates the potential leverage for us to reach schools throughout the state that we're not currently reaching. Our partnership with Blue Cross Blue Shield and with the state has allowed us to reach many, many more schools than we would have been able to reach otherwise. So we're poised to do more, ironically, with the team that we have. It's kind of the little engine that could. We can leverage our talent and our modules far and wide if we have the right partnerships and additional support. Let me ask Jean and Ben if they want to add to that.
I think I would add that, our other goal is to make this available for everyone, no matter what their background, to make it relevant for everyone. Thus our DEI initiatives that we're doing, because, students live in different communities with different resources. The talking about vegetables, like I go back to the UP where my champion up there in Newberry says, we can't afford to get red peppers for the salad lesson. One red pepper is, $10 up here. So, we want to make our lessons, our program continue to evolve with the way the world is for the students, and to make it so that they can develop these, good, healthy habits within the neighborhood that they live in. That's, I think, one of our other important messages.
Ryan, let me talk a little bit about the power of philanthropy in this program, if I could.
Absolutely. Yeah, we were just going to transition over to that. So go ahead.
Project Healthy Schools is supported by what I call soft dollars. It's not a line item on any budget. It has forever been supported by gifts. We've been incredibly fortunate that Michigan Medicine has felt it would be an important project to continue, and serving the communities of the people that work at our health system, for example. Similarly, Blue Cross Blue Shield, the state of Michigan, many foundations and individuals too. The program started in a middle school because two members of the school board who were patients of ours stepped up and said, we want you to take some money and try a pilot program and see if it can work. We have an individual couple in Ann Arbor who said, we want you to try to take the program down into the grade schools and up in the high schools. We have several donors in the Detroit area who want to see us continue programs in schools in less favorable economic situations. So the power of philanthropy is making the ability for us to do this real. And anybody who's listening to this or watching this, anything you can do to help us matters. This is sort of like hand-to-hand combat. We're raising money for each school, each child. And I can't emphasize enough to you how important this is to our ability to continue and hopefully expand our program. It's absolutely vital.
Yeah, I think that's right. Can I pop in real quick here, Ryan? Because I think, you know, something I haven't had a chance to mention up to this point is when I talked about our 5-step approach, you know, to school wellness. We know that behavior change takes a long time. It's not something that gets turned around overnight or within a week or even within a few weeks. And so when you couple that with all of the other competing priorities, you know, that schools are dealing with, that teachers are dealing with, that students are dealing with, we know that this takes a really long time. And so, you know, another thing I think that sets this program apart is we're not a one and done program. We're not a program that goes into the schools, works with the schools, and then, you know, at the end of the year, we kind of, okay, here you go, you're off and running. We know that schools don't work that way. There's a lot of competing priorities. We know that there's, you know, years ago, you know, we had a pretty static, I think, you know, teaching environment where, you know, there was pensions and teachers went into a school district and they stayed in that school district and they were in that district for the duration of their career. And we're kind of starting to see that change now. And so teachers are kind of moving around a little bit. So, you know, when you think about sustaining the program in the school, when there's, you know, a turnover, you know, we continue to support these schools after year one. I mean, you know, we've got schools now have been in the program for 16 years, and we continue to support them not only with resources through our PHS portal and, you know, a wellness coordinator to support their efforts, but also with funding. And so supporting schools to implement these changes takes time, which is very valuable within schools, but it also takes funding to support that. And so, you know, we're a program that continues to support that through a variety of ways. And so I just think it's, you know, just wanted to kind of dovetail off what Dr. Eagle was saying.
And Dr. Eagle, thank you very much for sharing with us the impact and importance of philanthropy and what that has on our program. It's time to move into our Q&A portion. And again, for those of you who are tuning in on Zoom, you can use the Q&A function. We do have quite a few questions that have come in. Ben, you were just talking a little bit about measuring success. So one of the questions was, how do you measure success in a single school, and how do you sustain success as well?
Yeah, that's a great question. So we've used a variety of tools throughout the years. You know, when we had, Jean was talking earlier about, you know, lowered cholesterol and triglycerides and things like that. You know, that was through, you know, physiologic measures, finger pokes. So we've used tools like that in the past. We use a lot of survey tools with teachers, again, with students. We do a health behavior questionnaire, a pre and a post. So we take a look at baseline health behaviors before students engage in our educational materials and environmental change initiatives. And then we do a follow-up after to see what are the specific changes that have happened throughout the course of programming. And so that's what it looks like, in within a singular school. How do we continue that is again through our assessment tools that we've taken on. And so reassessing and looking for those kind of changes over time. We also take that data from the surveys and from the questionnaires on an annual basis within the school, and we share that with the school. So each year we're going into a new school year with more data than we had the year before. Again, so that we can prioritize the needs, because is there time? Is it realistic to address all of the needs every single year? Unfortunately not. We wish we could, but that's not necessarily a realistic approach to the school-based programming. So, those tools are very valuable. And again, just help us each year. We're continuing to work with these schools and getting more data on the schools, and that kind of helps us, again, create unique programming unique to that school and the student population.
Let me just add to that. I think it's an interesting question. Early on with the program, we were really measuring virtually everything that we did. And with many of the students, we measured not only their health questionnaires before and after the program, but also cholesterol, blood sugar. We did stress testing, we did blood pressure, heart rate response, things like that, to verify that there was evidence of benefit. And we especially were interested in making sure that the program benefited not only communities that have more resources, but also those that have less resources. So nowadays we continue the health questionnaire because that really gives each school a snapshot of what the children's behaviors are like before and after, and gives them some sense of, I think, the value of the program. The real measure of success, I think, is the degree to which they engage and stay engaged. And the notion that 75% of the schools want to stay engaged in the program, their teachers, their principal, the students find it valuable, just says a lot to me in terms of the need that's out there and the opportunity that we have to continue to meet that need.
Thank you both for answering that. We've talked a little bit about how Project Healthy Schools is primarily focused on middle schools, but one of the questions that came in was, are there any plans to introduce this earlier on to elementary age children?
I can go ahead and answer that. Yeah. Well, right now we are partnering with Wayne State University in building healthy communities, and they have a program for elementary. So I think our goal is to, not reinvent the wheel, but partner with other people. If they're already doing it, that's great. And also work with the schools where they are. So you mentioned it's, I think Dr. Eagle mentioned our Ann Arbor program. In that program, what we're doing is we're talking to the elementary schools, assessing what they're doing, and then seeing how we can complement what they're already doing. So I think in that way, we are doing a intervention for elementary, but we're not reinventing, curriculum that's already out there. So our goal is definitely to partner with people, but yes, we do want the wellness continuum to, reach the elementary as well.
So one could imagine the notion that if in a community we partner with Wayne State and they're doing the elementary piece and we have the middle school piece, and working with Skyline High School in Ann Arbor and Cody High School in Detroit, we've developed a module called the Science of Health that a high school can adopt as part of its science program. Then you can imagine the continuum from primary, middle school, and the high school science effort, all that is complementary with the notion of health related to nutrition, movement, and things like that.
Thank you. We have another question that came in that's, given the stressors of the last year and the significant impact on mental and emotional well-being, I'm curious if you could share any initiatives you may be exploring to address students' mental and emotional well-being.
Yeah, go ahead, Ben. I think.
Yeah, sure. Yeah, as I was kind of talking to earlier, we've certainly seen that rise, and we know that teen depression is on the rise, and stress and anxiety as a whole, again, has created a more opportunity for us. And so, again, here at the university, we have content experts for everything, and it's kind of our goal to seek those out and not always feel like we have to reinvent the wheel. And so we're fortunate here at the University of Michigan to have a great group called Trails, which has been engaged in this type of work, and they've created lessons for each grade level, K through 12, which have been piloted and have actually been adopted by all close to 100 schools within Detroit Public School Community District. And so we are excited to, again, we've already worked with them to create the teacher self-care modules, but we're excited moving forward to be partnering with them also to work with them to get more social emotional learning opportunities to students in the schools that we serve.
Thanks, Ben. Okay, we have time for a couple more questions. One is, in addition to philanthropic support, are there other needs that supporters could help you with? Do you still have a volunteer component to the program?
Yes, I can say we always have a volunteer component, and we always welcome volunteers in each community. So I think if you're in a community where we have Project Healthy Schools in your school, that would be something where you can obviously volunteer at the school when COVID is lifted, but you can also spread the word throughout your community and encourage people to support the program in your local community. We have a volunteer program through that we have university students working in the Ann Arbor community. That right now, of course, has been suspended because of COVID-19, but that will return. So we welcome all volunteers in any way, shape, or form. So please contact us, and we can maybe then help you to volunteer in your own community.
Yeah, can I just jump in and add something real quick to that as well? Is with COVID, obviously a lot of schools have students learning virtually. But even when students return, how soon are the field trips going to return? How soon are students going to be able to get outside of those the school buildings and translate what they've learned in the classroom into the real world? And so one thing that we've been working on is a virtual guest speaker. And so bringing kind of the outside world into the schools through a guest speaker series. And so I think there's opportunities to get more folks involved in that initiative as well, where students can, they get tired of hearing from their teacher all day, every single day. They always love the opportunity to hear from somebody new, somebody from a different background, different interests. And so we've been very successful at working with a lot of university partners to get them engaged in this virtual speaking series. But I think there's interest from friends of the program to get engaged in those virtual mentoring, virtual guest speakers. That's fantastic as well.
All right, next question. Is Project Healthy Schools on social media? If so, how can we stay engaged?
Yes, we are definitely on social media. Instagram, Facebook, Twitter. You can like us. You can tell your friends about us. I think we haven't really talked very much about Giving Blue Day today, but that's a really social media event where we're going to have people. It's a full day of philanthropy where you can give money on one day for 24 hours. And we have a goal of getting at least 50 people to just give whatever donation you want. It doesn't have to be big, small, we just need 50 people. And so yes, in fact, please go to Facebook, like us, go to Instagram, like us. And I want to put a little nod out to our social media person, Colleen Greene, who's doing a fabulous job. We're just going to give her that heads up.
Absolutely. Well done, Colleen. All right, last question. And it is the critical element in success having good on-site leadership at the schools? If so, what happens in schools that provide substandard leadership?
I guess I'll take this one. The answer to the question is it's absolutely vital that we have a wellness champion who believes in the program and is able to lead the school. Obviously, it's wonderfully helpful if the principal is really behind this and if a number of the teachers in the school are really excited about it. When we lose that, it's very difficult for us to sustain the program. And that's one of the reasons we have identified a wellness champion. We support that person in the school after we're sort of officially, once they're kind of on their own, their wellness champion is still part of our culture, our team, and we work with them. And if that person happens to leave, then we actively try to recruit another one. But leadership within the school is vital to the ability to sustain the program.
Yes, absolutely. Dr. Eagle, and I would just like to give a shout out to one of our principals who's joining us today, Mr. Burrows from Munger Elementary Middle School. I think that's a perfect example of the importance of the school leadership. And Mr. Burrows, we've been working with him and his staff now for, I think, 4 or 5 years. And it's just really wonderful, and it is vital. It's a really important concept. They're great thought partners. You know, we have a wonderful team. We have a lot of ideas on the team. And, you know, sometimes the ideas can maybe just be a little bit too grandiose. And maybe the timing's not quite right. So it is very valuable to have a partner, you know, great partners at the school leadership level where we can run ideas through and kind of brainstorm through and pilot new projects. Mr. Burrows is a perfect example of, you know, we create this kidney health lesson, but before we share it out with the world, we need to know if it works. And so, you know, to be able to go to Mr. Burrows and say, Mr. Burrows, here's what we got, here's what we've done. It's a high need area. What do you think? Okay, yep. He says, great, go ahead, let's give it a shot. I'm going to put you in touch with my science teacher. And so, yeah, very, very valuable. Very can't be understated. The importance of that that ally within the schools. So, Mr. Burrows, thank you.
I would just like to add that we know that, you know, the school is a unique environment, and each school is unique, and we are the visitors. So we need to have the people within the school own the program and tell us how it fits best in your school. So, you know, all the people that work with us at the school are so valuable, and we couldn't help students if we didn't have the contacts within the school.
Well, thank you so much to the three of you for all of the incredible information that you've provided and for all of the questions that we've covered today as well. Now, before we conclude today's webinar, it's been a real privilege to have our panelists with me, and also a real privilege to have all of you tune in. Thank you so much for your questions, which were fantastic, by the way. And while we tried to cover as many as possible, there still were some that were unanswered. So if you have additional questions, please feel to follow up with us and email us at projecthealthyschools@umich.edu. I do want to extend a sincere thank you to both our donor and our volunteer community. We talked about it a lot today, but the way you've lifted us up over the last year has been absolutely incredible. So thank you very much for supporting all of our efforts and allowing us to keep going and moving forward. Finally, we will be sending out a recording of the webinar, along with a few links that you can stay connected with Project Healthy Schools. One of those links, as Jean alluded to, is Project Healthy Schools Giving Blue Day page. Now, Giving Blue Day is on Wednesday, March 10th, so mark your calendars for that. And it's the University of Michigan's Day of Giving. Specifically to Project Healthy Schools, what's unique about this day is that we actually have a challenge gift available for $10,000 that will be released if we can get 50 gifts of any amount that are made. So if you consider supporting us in that effort, it would be greatly appreciated. Thank you all again for joining us. We do look forward to keeping you updated on our work, and we hope you have a wonderful day. Take care.